Assalamualaikum doctors. In this video I am discussing how can we manage hypoglycemia. So hypoglycemia definition is the blood glucose is less than 2.6 millimole per liter or 4 millimole per liter if diabetic. So 2.6 millimole per liter or 4 millimole per liter if diabetic. What investigation we do when hypoglycemia? First of all, bedside test we do the bedside glucose stick, bedside blood ketones and bedside capillary blood gases. Okay, so bedside blood glucose test we will do, and critical sample taken before glucose is given should be in lab within 15 minutes. Like glucose, insulin, C-peptide, free fatty acids, ketone bodies, that is beta hydroxybutyrate, acyl carnitine, amino acid, ammonia, lactate, bicarbonate, growth hormone and cortisol. Next steps is taken after glucose is given, that is full blood count, blood culture, CRP, urea electrolyte, liver function test. Others are alcohol and salicylate, urine dipstick for ketones, lab urinalysis, organic or amino acid metabolites and reducing substances. Okay. So how can we manage the hypoglycemia? Patient comes, we measure the random blood sugar and find low. First of all, assess the airway, breathing and circulation, ABC. Assess consciousness level to determine the route of treating hypoglycemia. Obtain IV access, bedside test and critical sample. So we are taking the bedside and critical samples, then treat hypoglycemia, involve the senior, admit, monitor blood glucose, pediatric endocrinologist in case of hyperinsulinism. So treat of hypoglycemia how? If child is conscious and not vomiting, give oral glucose dextrogel. Okay, oral glucose dextrogel, half tube 5 gram for infant less than 6 months and 1 tube if more than 6 months. Okay, so oral glucose dextrogel we are giving. If infant older, give oral glucose 10 to 20 gram. 2 scoops of polycal in 30 ml milk or water, 200 ml milk or 2 teaspoons sugars followed by a snack of starchy carbohydrates or a milk feed in infant. So we are giving 30 ml milk or water or 200 ml of milk and 2 teaspoons sugar and followed by any carbohydrate snacks. Reassess after 10 minutes. If still less than 2.6, give IV bolus glucose then infusions. If improved, continue to reassess that and discuss further management with the consultant. So we will after 10 minutes reassess. If it is 2.6 below, then we IV access give, and if it improved, talk with my consultant. In patient with altered consciousness, GCS is 8 or less. So child is unconscious. First of all, IV access 2 ml per kg, 10% glucose and intravenous bolus, followed by infusion of glucose 10% and sodium chloride 0.9% at 100% maintenance fluid. So IV access will open, we giving 2 ml per kg. Remember 2 ml per kg, 10% DA, glucose we are giving, and IV bolus we are giving 0.9%, 100% maintenance fluid. No IV access, then glucagon IM we give 0.5 milligram if less than 8 years, 1 milligram if more than 8 years or 25 kg. This must be immediately followed by IV or IO access with infusion of glucose to maintain the normal glycemic state BG more than 3.5 millimole per liter. Reassess after 10 minutes. If still less than 2.6, bolus dose of hydrocortisone, then hydrocortisone infusion if not improved. If improved, continue glucose infusion, reassess the ABCD, discuss further management with the consultant. So you understand the management. First the child come, ABC, everything we notice and measure the blood glucose, we find below 2.6 millimole per liter. Child is alert, conscious, can eat, no vomiting. So according to age we are giving oral glucose. Oral glucose dextrogel or oral glucose tablet we are giving. We can 2 teaspoons sugar which is with the milk we can give, and after that any carbohydrate, starchy carbohydrate, and after 10 minutes we will be reassess the blood glucose level. If it is more than If it is less than 2.6, then IV access we open. If it is more than 2.6, talk with the consultant. But the child is unconscious. The child can't eat. First we will give IV access. We give 2 ml per kg, 10% glucose. We are giving bolus. Then we are giving with 100% maintenance fluid, 0.9% sodium chloride. But IV access is not possible to open, then IM glucagon we give. And after 10 minutes again reassess. If not, after 10 again less than 2.6, then we will be hydrocortisone give. Bolus dose of hydrocortisone. We improve, continue glucose infusions. Monitor blood glucose levels for 24 hours. And we will monitor the blood glucose level for 24 hours. How? Initially every 10 minutes, then 30 minutes after any change in fluid, hourly until 3 normal values obtained, 2 hourly until 3 normal values obtained, and 4 hourly thereafter. So initially 10 minutes after, then 30 minutes, then 2 hourly, then 2 hour, 4 hour. Discharge and maintained normal blood glucose level and restarting oral feeding and discharge with glucometer. Advise check blood glucose during a period of illness and avoid prolonged fasting. So we give that period of illness, any fever, they will check their blood glucose and avoid prolonged fasting. Thank you.